Last year, then, a European network on reducing marketing pressure on children was formed, and this is an action network of WHO member states in Europe. And currently there are 14 countries involved here. Iceland, unfortunately, did not have the capacity to join, even though they expressed their willingness early on. But the other Nordic countries are part of this network. And we had a first meeting early this year in Oslo, and there is a website where you can download the report from this meeting. The long-term goal of the European network is actually to support the work that's going on at the WHO headquarters and to help protect children's health through sharing experiences and best practices in order to help substantially reduce the extent and impact of marketing to children of these energy-dense micronutrient-poor foods and beverages. So there are a number of more specific objectives, namely trying to identify and demonstrate specific action to protect children against marketing pressure, share experience from what's been going on in different countries, and try to monitor whatever volunteer action or statutory legislation that's being passed, discuss alternate approaches to regulation, and also nutrient profiling to help identify what are then labeled nutrient poor and energy dense products. And the aim is to report back then, both help report back to WHO Europe Steering Committee and also the World Health Assembly. The network then will contribute with knowledge and experience to support the work to develop a set of recommendations at WHO headquarters, so working closely with them. And we have formulated two work groups, one that is focusing on the content of regulation, whether it's voluntary action, which may help to promote sound practice that the industry itself kind of police what they're doing. But there also seems to be a clear need for more statutory regulation to reduce the overall extent of marketing. And then the other working group is looking particularly into monitoring system, as it seems to be very important to have a good way of monitoring whether some changes actually do take place. The time frame for the network is to work for the next 2 years and to be able to feed into the process in the preparation for the World Health Assembly in May 2010, where the Secretariat will have to report on their work on this area. Here are the Nordic representatives, the key people participating. And right now we are looking for more people who can help carry out activities linked to the network. So if any of you are interested, please notice who are the contact person from your country, or contact us at the Secretariat in Oslo, and we can help put you in contact with the right people. There are a number of key challenges in this area, and one is what I've already pointed to, this discussion about self-regulation versus voluntary codes or statutory regulation, or whether there can be some combination of these. And different countries come into this work with different preferences and also experience from different methods, and we're trying to learn to see what is working and what is needed. There's also a big discussion about what is it that should be regulated. Some advocate that all marketing to children should be banned, or that at least all food marketing to children should be banned. But the network for now is focusing on reducing the marketing of unhealthy foods to children. And then, of course, the question is how to define unhealthy food, and the nutrient profiling become a key issue. There's a lot of discussion regarding age. WHO defined children as anyone under the age of 18, while a lot of the volunteer and self-regulation that's taken place so far is focusing on children under the age of 12 or 16. So that's an issue we're debating. The starting point is to look at WHO's definition as those 18 and younger. And then whether we should focus on certain marketing techniques or to include all type of marketing. And that is our point of departure, that we're looking at all marketing techniques, including the new electronic media. So in conclusion, marketing of unhealthy food to children is extensive, and it clearly has an impact. Children everywhere need better protection against marketing pressure. The growth of marketing activity in emerging economic and developing countries is of special concern. And it was very interesting when this was passed by the World Health Assembly in Geneva last year. It was actually the African region that really helped push this up on the agenda. National actions to regulate marketing are inadequate on their own due to the cross-border nature of many marketing techniques. So international collaboration and action really is essential. And the European network hopes to be a driving force in this area, and I really hope that the Nordic countries together can help to be also a driving force within the network. So again, if anyone are interested, here is our website, and please contact us if you're interested in participating in this work. Thank you.